With a globally aging population, the advancement in diagnosis and management of heart failure has become very important. Fujifilm is innovating healthcare by developing innovative ultrasound solutions. Introducing Hemodynamic Analytics, the unique solution that provides insightful clinical data beyond cardiac anatomy and function. In echocardiography examination, assessment of the left ventricular function is of utmost importance. However, about 25% of patients remain undiagnosable due to suboptimal images. For example, plus-sized patients, patients with high lung pressure, or ICU patients. In such cases, clinicians could only estimate the ejection fraction or make further evaluations with contrast agents, which is invasive, expensive, and time-consuming. To overcome these limitations, Fujifilm introduces virtual contrast, a non-invasive, high-definition imaging mode, which mimics the effect of contrast echo, to drastically improve visualization of endocardial border in technically difficult patients. As shown on the left image, it is impossible to evaluate the heart function. With just a touch of a button, clinicians can now use virtual contrast to visualize the endocardial border in the left ventricle, for a confident quantification and assessment of left ventricular function. With drastic improvement of the visualization of endocardial border, virtual contrast can be the first-line method in the assessment of left ventricular function. Virtual contrast has been proven to provide comparable results in LVEF analysis and has significantly shortened the examination time, in comparison to LV opacification. On top of ejection fraction, virtual contrast can be used to examine pathology like aortic arch stent leak, RV apical aneurysm, artery obstruction, or non-compaction cardiomyopathy. This is due to its superb sensitivity as compared to conventional color Doppler. DualGate Doppler increases the reliability of diastolic heart function evaluation in patients with arrhythmia as compared to conventional single Doppler. Conventional single Doppler often under- or overestimates diastology parameters due to heartbeat and respiration variations. It is thus required to obtain an average of 5 or more measurements in patients with arrhythmia inters. On the other hand, DualGate Doppler allows observation of Doppler waveform from 2 locations simultaneously in the same heart cycle, thus eliminating beat-to-beat variation. This unique algorithm comes in 3 combinations: PW, TDI, 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 or PW, PW. In addition, DualGate Doppler coupled with anatomical intelligence technology enables users to automatically select the appropriate heart cycle and generate an automatic measurement of E over E prime in just 5 seconds. Hence, DualGate Doppler serves as an ideal solution for the assessment of diastolic function, especially in atrial fibrillation patients. Detection of subclinical changes in myocardial function is also important in the management of heart failure patients. 2D tissue tracking offers extensive parameters of myocardial strain, including global longitudinal strain, circumferential and radial strain, as well as twist and torsion. Now, introducing the most exciting novel technology in the echo world. A normal intracardiac flow from the left atria to the left ventricle, then fully ejected out from the left ventricular outflow tract. Under disease state, the flow mechanics could appear completely different. Therefore, understanding cardiac flow mechanics within the left ventricle is important in planning for early treatment in heart failure patients. In the past, assessment of flow mechanics is only available in cardiac magnetic resonance, which is extremely rare and costly to perform. With continuous innovation, Fujifilm has successfully brought this MRI technology into ultrasound. Vector flow mapping is our proprietary technology, which enables clinicians to examine the intracardiac flow readily in routine echo lab, with promising diagnostic outcomes. Energy loss, vorticity, and relative pressure are potentially new echocardiography parameters that give valuable insights in the assessment of cardiac function like heart failure, congenital heart disease, and valvular heart disease. What's more, vector flow mapping is the only non-invasive tool that has been validated to examine the intracardiac flow. Fujifilm's Hemodynamic Analytics beyond the evaluation of cardiac anatomy and function, achieving more reliability for diagnosis and treatment of cardiac disease. Designed for you and your patient needs. Fujifilm, value from innovation.